society affects your health? Society means what? The people around you. How the people around you affects your health. We can think that I am the only person who can affect me. If I have good behavior, good character, good activity, I will be healthy. But how society depends on my health? So this is what the today's class. There is a terminology called social determinant of health. SDOH. Social determinant means how much society can impact our health. That is 40% of our health depends on our society. If you are having some disease, you might have some pills or tablet to cure. If society has some disease, can you cure? No. There is no medical factors for society. Social determinant of health is called non-medical factors, and these are one of the factors of health outcomes. In social determinants, what are the further factors? Economic status. If you are in rich country, if your society is very rich, you have the clean environment. Certain countries, if you go, you will not have clean environment. If you search on well-developed countries, UK, Australia, then American countries, their environmental concerns are much more. You cannot pollute the environment. Can you throw the paper? No, you cannot. Even by throwing papers, even by spilling something, you cannot harm the environment. But in India, can you do that? Yes, you can easily pollute the environment. But in well-developed countries, you cannot pollute the environment. That is called the economic status. How the status of the society, that depends on the healthcare and nutrition. Next thing is education. Higher we educate, higher will be our society. Imagine we are completely surrounded with educated people. That means which will improve your health. Insurance companies will give you insurance. In certain countries, they will not give insurance. In certain countries only they give insurance. That depends on the education factor and environmental. Next, healthcare and access. Culture and lifestyle. What are the cultures followed around you depends on your health. This is called culture and lifestyle. So, what is surrounded by us, how we follow our diet, exercise and medical treatment. If you go to certain countries, they will be not having rich fibrous food. Diet, exercise and medical treatment depends on a culture. Certain culture will not go for treatment. For smallpox, what they will do? Home remedy, no? They will not go to hospitals. In their house itself, they will take the treatment. So this is a cultural belief. For certain culture, they believe that going to the hospital or going to the doctor, it is not in their culture. So that also is a factor for the health. Next thing is, this is statistics. If you have a mentally strong culture, societies with strong family background. Which are the countries have strong family background? Well-developed countries don't have family pattern. If they are grown, they will be independent. Now you see, this is a statistics I have taken from the WHO. Suicides. At young age, people are making suicides. If we are checking, can you see this region of America? This is a statistics which is taken from that. And can you see high amount of suicides? So this is homicide. Homicide means what? Killed by others. Killed by others. Suicide means we are killing ourselves. In European region, can you see a high number of suicide? At which year? 2000 to 2021 you can see highest. When you compare other countries, these are all other regions. What are they? African region, American, South Asian, etc. like that. Which country have more suicides is European region. You can see highest number of suicides happening. Why? Because they don't have support. If you think that if I am coming out of the family, I will be independent. But what happened eventually, you don't have emotional support. You cannot share your thoughts. You cannot share your emotions independently with others. If your family or family members gaining you the emotional support to you, which helps you to get rid of all the mental stresses. But in well-developed countries, African regions, you see, so which is Indian region, South East Asian region is India. Can you see it is very less. Why? Because we have strong social support. Next thing is public policies and governance. How much government help in our health? What are the things they are giving for our health? Are they providing clean water? Are they providing water? If yes, then governance is good. Places where they don't have water, people have to pick water from the wells. How much clinics, government hospitals are there? These are depends on the government. Government provides you vaccination free of cost. If you are there in well developed countries, in India it is free. In India you have public health care for free access. If you have Aadhaar card, you can access to central government health insurance for 5 lakhs. Up to 5 lakhs central government is giving health care for you. Health insurance is available. So these are the facilities provided by the government. If you go to foreign countries, government will not give you health insurance. You have to buy personal insurance like that. So this is how public policies and government puts an input for your health care access. So they have nutrition targets. In 2025, what are their targets? The government will support you in reducing anemia, stunting, childhood, overweight, etc. Next, how health affects your society. Previously, I have discussed how society affects our health. Now, how health affects our society is economic impact. If we are healthy, we can have higher GDP. This is economic impact. Next thing is social stability. If we are healthy, we could easily combat COVID. If we are taking care of ourselves, we can prevent the COVID. These are all what kind of disease? Communicable. That is mean spreadable disease. Then quality of life. It improves our quality, increase the lifespan. Individual's lifespan we can increase. It improves the mental health, improving the health in the society. Invest education and awareness. If you are a government, what you have to do? If your society wants to improve in the sense, you have to invest in education and awareness. Give education, that will automatically improve the society. Promote accessible health care. That means at every rural place there should be a clinic, healthcare clinic or hospital should be there. Next thing is health policies. Government should provide clean water, air pollution, solid waste, water pollution should not be there. Public health policies such as vaccination has to be improved, etc. Healthcare system, health inequality, epidemics and pandemics. What are social determinants of health? B. Non-medical factors that influence your health. Everything are cured not only due to medicine. Certain things are cured due to social. Yes, you are right. How do cultural benefits influence health? B. They shape attitudes towards diet. Yes. Yes, you are right. Next. How do government influence on public health? Through policies, vaccination, pollution, control, etc. B. Yes. Now, what is the benefits of universal healthcare system? They follow in Canada and Europe. Universal health care, broader access to medical service. Yes, you are right. A. Yes, A is right answer. They provide broader access to universal medical service. How much mental health awareness benefits society? A. It reduces stigma. What is stigma? Stigma means what? Certain people don't like tall person. If you are tall, they will don't like. Certain people, they don't like if they are short. Some people are short, they don't like. Hatredness towards something. Certain people, they don't like. You are putting saffron. Certain people don't like white color. If they put white color, automatically in their head, they will have the stigma. Stigma is what? Predetermined some thoughts. That is called stigma. Society effects on stigma. It reduces stigma, promotes better community support. Next, which of the following is an example of public healthcare policy? Yes, you are right. Example of public health policy is, if they ban smoking and food regulation is the